Good morning. Thank you so much, Deputy Director Goodsky, for joining us. We're so glad to have you. I think that folks are just popping on this morning, so we will give them a little bit of a minute. And as we do, welcome. How are you? It's great to see you and to meet you. I've heard lots and lots of really great things about you, and excited to have an opportunity to get to know you a little bit more this morning and into the future.
Doing really well this morning. Thanks for having us. I think Rebecca's on as well. Good morning, Rebecca, and good morning, everyone else.
We'll wait a few minutes here.
Good morning.
Hey, Lainey. Ooh, you look so bright this morning.
I guess so. Thank you. If the sun is out, I'm happy about that.
Here too. Morning, Rebecca.
Good morning.
We're waiting just a couple of minutes here.
Sure.
It's an exciting day for everybody who has kiddos that are 5 to 11.
Yes.
I was scheduling my appointments this morning, and the scheduling thing kept changing, because clearly at 6 in the morning there are a lot of other parents racing to get their kids jabs in the arms.
Yeah, I was just talking to my grandson yesterday about that. He's 6 years old. And he has a pretty good understanding of what's been happening. And so I was like, pretty soon you're going to be able to get a shot for this. And he's, oh, but it's a good thing, buddy. It's really a good thing, So.
I know crafting the incentive narrative around a shot is a little bit, there needs to be some immediate, you can watch a YouTube video of cats while you're getting it done, and then I will give you a lollipop. But then think about all the exciting things you can do. Go bowling,
Right.
Go to movie theater.
Right. Yep.
Anyway, it's an exciting day. Well, I do want to respect everyone's time. I know that there are a number of folks who said that they really wanted to be here this morning and life is complicated. So we are recording this session so that folks will be able to take a listen after our time. So we're really honored to have Yvonne Goodsky with us. She's the Deputy Director of the Child Safety and Permanency Division. And she, along with Rebecca Wilcox and their colleague Jennifer Sommerfeld, are here to share with us a little bit of an update around the Family First Prevention Services Act Prevention Service Plan. We have numerous folks on this committee and beyond within the association who have been tracking on the working group efforts around the prevention service discussions and a whole host of other topics within Family First. And I think that now we have kicked off the residential side of Family First, and the big question is, how is this prevention service plan moving forward, and what is the significance? What does that mean for us as we think about that prevention service array that is part of Family First? And what does that mean for us as we think about building a family service array that really is outside of, but potentially connected to the spirit of Family First, as you think about the opportunities to build those enduring responses that are really family-centered and family-driven. So thank you again for joining us, and maybe Deputy Director Goodsky, if you want to give a little bit more context or introduction, that would be delightful, and then we can go around and just give a chance for everybody to introduce themselves as well.
Absolutely. I want to say good morning to you all. Happy to be here. My name is Yvonne Goodsky, and I am currently the Deputy Director of Child Safety and Permanency, a role I've only been in for about 4 months now. Prior to that, Nikki Coban served as the interim and really got the Families First Prevention Services work off the ground, of course, with Rebecca Wilcox, who has been leading this work as well. I come to the department, I've been here 7 years today, starting off in the Office of Indian Policy, working really closely with tribal nations on a number of different efforts, and then came over to the ICWA area of CSP, and then recently, as I said, been promoted to this job. My history, a little bit about me and my background, I've spent about 30 years in the area of child welfare. Started off in a residential program for American Indian youth called Indai Young, where I spent about 21 years of my career and really got grounded in serving families from a cultural perspective. So I bring that with me as I come to this work. Was at Hennepin County as a manager for a couple of years, also was a program officer for the St. Paul Foundation. So that's a little bit about me. I'm enrolled with the Lakudere Band of Lake Superior, Ojibwe. So I'm very, very active in my community, both tribal and urban. Again, I'm really happy to be here and to assist Rebecca, because Rebecca is really the one that's going to walk us through what we've been doing. And I'd be happy to help answer any questions. Miigwech, thank you.
Thank you so much. I apologize. I was certain that I was pronouncing your name correctly, and I was totally botching it. So I made a picture of the sky, so I won't forget.
Good sky, yes.
Good sky. I apologize. Welcome. Thanks so much for being here. And yeah, I think that we'd also love to hear kind of your vision for, you know, how the Family First, but then also the other work under your purview will continue to move ahead, and maybe we'll have a chance for that earlier or later. But before we get into that, let's just go ahead and do a round of introductions so you know who's on the phone. I'll just call on folks because it tends to be easier that way. Paula, do you want to introduce yourself?
Good morning, I'm Paula Minsky. I am the Vice President of Clinical Services for Nexus Family Healing. Nice to meet you all.
Lainey?
Good morning, Lainey Janke, Director of Community-Based Services at Therapeutic Services Agency.
Thanks, Lainey. Mel?
Hi, my name is Mel Winkler. I'm the Quality Assurance Director for Northwood Children's Services.
Our committee chair, Rob Edwards.
Hi, good morning. Didn't know if I was going to be here with you because I was on vacation, but Rob Edwards, I'm the CEO at Lee Carlson Center for Mental Health and Wellbeing.
Thanks for joining us this morning, Rob. And Shannon?
Hi, I'm Shannon Brown. I'm the Executive Clinical Director at Fernbrook Family Center.
Thanks, everyone. I'll just turn it back to you, Rebecca and Jennifer, to introduce yourselves as well.
Sure. My name is Rebecca Wilcox. I'm the Manager of Child Safety and Prevention Promotion area in the Child Safety and Prevention, Child Safety and Permanency Division in DHS. Thanks for having us today.
And I'm Jennifer Sommerfeld. I'm the Legislative Director for Children and Family Services. And I'm looking forward to the presentation. So thanks for having us.
Great. Well, we'll just hand it back to you, Yvonne and Rebecca.
Mm-hmm. Yeah, I know Rebecca has put together some slides to share today. So I'm going to ask her if she could pull those up and get us started.
Sure, and I'm not as familiar with Zoom, so I'm hoping that this is sharing my screen.
We got it.
Okay, let's see. All right, so here we are talking about Family First, and I think it sounds like you all have some good background on Family First, and we're specifically coming to talk with you about the prevention services elements of the entire federal law, right? There's a number of elements, but prevention services is one of the two major elements of Family First. So really helping to prevent kids from entering foster care in the first place by offering specific types of services that are focused on mental health, substance abuse, and home parenting and kinship services. Just a reminder of some of the main components of Family First. There's eligibility, so children have to be eligible or have to be considered a candidate for foster care or imminent risk of foster care. The only exception to this is kids that are parenting or pregnant and in foster care. Again, those services have to fall into one of those 4 categories: mental health, substance abuse, in-home, and kinship navigator skills. And I actually had that asterisk on kinship navigator because there hadn't been any kinship navigator programs approved, but Ohio's program was just approved like 2 weeks ago. So there's now a program in the clearinghouse. The services have to be well supported, supported or promising, and they have to be rated by the federal FFPSA clearinghouse. And they continue to rate programs on an ongoing basis. And of course, we've got our eye to that clearinghouse. And it also requires states to submit a 4E 5-year prevention services plan to be able to claim. And on that plan, we have to outline what services that we intend to claim, what the eligibility is, of course, for the children, what our candidate pool is, and define our CQI and evaluation plans. So for candidacy, as I mentioned, the kids that our candidates have to be at imminent risk of entering out-of-home care. That definition is left to each state to decide who in their state is at most risk of out-of-home care. And again, that other exception, pregnant or parenting youth in foster care. Once a candidate is identified, there's a few things that a state has to make sure that is part of their plan and part of the implementation of Family First. And that's safety must be monitored, risk assessments must also take place. A prevention plan, like a service prevention plan, must be developed. And at 12 months, if the services continue to be needed, the child continues to be a candidate, a reassessment essentially has to take place to determine that all those things are indeed still applicable. There are a number of federal reporting requirements, so we are going to have to develop and maintain access to basically client records, not just during the service portion, but also tracking after delivery. So after 12 months, they want to know, did this child end up entering foster care, essentially. So the service, like I mentioned, had to be in one of those 4 categories. It has to be on our 5-year 4E prevention plan. They must be trauma-informed, evidence-based, and again, approved by that federal clearinghouse. For each service, there is a fidelity monitoring process as well as an overarching CQI process for the entire plan. So essentially, how do we ensure as a state that the program as approved on the clearinghouse is being followed to the standards outlined in that program model or program requirements? And also, how do we know as a state that this plan is working for the kids that we're serving? So kind of that overall CQI process. Also for an evaluation is required for those services that we have in our 5-year plan that are in the supported or promising practices area. So well-supported practices, according to the clearinghouse, do not have to have an evaluation, of course. Those of you familiar with the evaluation know that those are significant and require ongoing investment. Here's a little bit more about our governance structure that has been in place. So we've got, of course, us on the far right here with the commissioner, DHS commissioner. We've been in consultation engagement with our tribal nations and our Indian Child Welfare Advisory Council. We've been involved with MACSA steering committee and a core committee. And of course, our prevention services work group is our main work group, which hasn't met for a few months. And then the sub work groups within the work group structure. We used our work group structure to help us guide us in recommendations around our current 5-year plan, or the draft 5-year plan, I should say. So we had that overarching work group at the top with our subgroups underneath. So we had a candidacy subwork group working on our candidacy definition. We use data to look at which kids are the most at risk about entering out of home care. Once we had the candidacy definition, we looked at the service array, what was currently available and what could be sort of the easiest to implement across the state that also met the kids that we have identified at most at risk of entering care in the state. So it was a kind of a couple of different processes that we used there to identify initial proposed services. We had a prevention case planning subwork group that looked at making recommendations around what the prevention plan, service plan would look like. So making modifications to existing service plan by including prevention services components that would meet the requirements under Family First. We had an expecting and parenting youth subwork group that looked at recommendations around that population, who would be categorically eligible, how they'd be identified, and also made recommendations for the services that would be applicable for that particular population as well. The last subgroup that has not started yet, we're on the verge of being able to start that work group, and that's the continuous quality improvement subwork group, which will look at the recommendations of services that we're proposing for our initial plan and really drill down into what the requirements are under Family First. So this grid just tells us a little bit more about where we've been. So we've got some draft recommendations around candidacy, around services, expecting and parenting youth, initial service array, and that's of course done with the engagement process that I just mentioned. We're currently in our fiscal analysis of the services and looking to start our subwork group around fidelity monitoring and CQI. Looking forward at developing a training plan and putting together a draft of our 5-year plan. Certainly there's a number of other elements that have to happen once we submit the plan or just as we're submitting the plan, right? Developing claiming processes, modifying our system, et cetera, as well as developing training and making sure that the workforce is supported in ways that they need to get supported throughout the process. So currently our proposed candidacy definition in a nutshell, this is kind of the brief version, is a child who is in home and also receiving child protection case management services in our system. The initial proposed recommended services were these 7 services: motivational interviewing, Healthy Families America, Parents as Teachers, Family Spirit, TFCBT, CPP, and high fidelity wraparound. And currently high fidelity wraparound has not been rated. We're still waiting for the clearinghouse there. It's under review at this point in time. The initial services that we're looking at developing our CQI plans around are the two of the well-supported programs, which are the ones in green, the motivational interviewing and Parents as Teachers. There is some exploration of Family Spirit happening as well. However, because that is a practice, a service that is typically used with American Indian families, we feel very strongly that we need the tribal consultation process, tribal engagement processes to continue to happen, engage them in their thinking around Family Spirit as a service for Minnesota and the kids that service would serve. And so that's why that's in blue. We just need a little bit more time to work with tribal nations on that particular recommendation. So kind of how we're thinking about this, right? So the subwork group those recommendations are really based on what's currently available in Minnesota. Are they currently rated by the clearinghouse? Will they meet the needs of the kids that we see in our system currently, and that meet the current candidacy proposed definition? So that's sort of what we're thinking initially, right? We can submit in our initial plan. Simultaneously, what are some future services that might meet the needs of kids and families that are involved in our child welfare system that may be included in a future submission of the 5-year plan? So what some of you may be familiar with is that just because it says 5-year plan doesn't mean that we can't modify it within that 5 years and beyond. So that is our goal, is to do an initial submission, of course, with potentially the 2 services, with the idea that we would continue to modify that and add services as we're ready and as the needs are identified, and we can make those happen. So a resubmission is possible. We just need to get reapproval by the Children's Bureau for those services to be included and claimed. So that's in a nutshell where we're at, and that concludes our formal presentation. And of course, we can turn it over, Yvonne, if you want to add anything else, or if there's, you want to turn it over for questions.
Sure. I mean, I think you did a really wonderful job on an overview here, Rebecca. Just some reflections on this work, being sort of new to this. We're figuring it out as we go, right? With counties, with tribes, with community. This is not something that was, a roadmap was laid out and here's how you get from A to Z, right? And so it's been a process, a learning process. And where we're at this point is in terms of, communication with those partners that are very much needed in helping to make this happen. With our county partners, we continue to meet on a weekly basis with something called the core team that Rebecca may have alluded to a bit earlier. And so we meet on a weekly basis right now, and we continue to talk about conversations right now are around the 2 initial services that will become part of our plan that we hope to submit early 2022. So it's conversations around motivational interviewing, parents as teachers. There was a convening 2 days ago, providers and county systems in the state that are providing parents as teachers for some learnings. Rebecca may be able to talk about that later on. And so, convening on a weekly basis to continue to get to the point where we're going to be able to submit that plan, the prevention services plan. We have released the draft to tribal nations and to county partners. I think a smaller group of county partners right now at this point in time, but we are definitely wanting that feedback. How does it look? Are we on the right track? And in preparing to submit that later on. The other part I want to share that's really, a core value of mine as sort of a child welfare practitioner and a leader is we want to learn how other states are doing this work. So we recently had conversations with the state of Oregon about how have they rolled out their approved plan, where are they at in the process. It was really enlightening to talk to some peers. We plan to do some other outreach as well. And then the other part I'll just mention too is that we've been in communication with our Region 5 representative, Meryl Pontiac, who is the new Cindy Lauder, Region 5 representative, about where we're at in the process, and got some feedback and some guidance as well. So. We are open to questions, observations.
Thank you so much for that presentation, Rebecca, and for your reflections, Yvonne. I think that it's helpful just to know the time frame. So anticipating a submission of the plan early 22 and implementation summer of 22. Is that right? And based on your conversation with Region 5, are you kind of getting some of the supports and technical assistance to anticipate that that will be a process they're capable of responding to? That works
yes,
for them?
As I recall, Rebecca, help me out here. As we were talking to Meryl, and Cindy Lauder was actually part of our phone call, they thought that timeline would work out pretty good actually in terms of where they're at with other states and anticipated plans coming in, and those have already been approved. So they thought that timing sounded good in terms of their ability to help us get that first first plan looked at and any needed revisions.
Great, thanks. Just wanting to get the basics understood. So yeah, what questions do folks have?
Hi, I'm just curious, I guess, from having conversations with another state, is there anything that you could share with us about lessons learned about what they are doing that Minnesota may consider?
Do that with her.
Rebecca, do you have some reflections on that?
You know, I think my main reflections were that it really is in the implementation and pre-implementation work is where things get real in terms of setting any programs up. And what we learned also from Region 5, along with our other state partners too, was really how to monitor the fidelity to the model that's been approved by the clearinghouse. That point was drilled, I think, with both of those conversations in terms of how the state plans to do that, and then how we not only plan to, but how do we actually implement our plan. So I think those are kind of the things that we're looking to further develop in our sub-work group.
Mm-hmm. I think the other thing is that we were a little bit surprised that they're still figuring things out, even though they've got an approved plan, even though they're in the implementation process. You know, I think we had expected to hear, here's how, you know, we rolled out motivational interviewing, the training, the fidelity monitoring, etc. And we, you know, we heard that they're very much well in that process right now. And so to know that absolutely we have to have a plan figured out at the time of submission. Some of the pieces are going to come later. I know one of the questions, because I reached out and said, you know, hey, can you let us know anticipated questions? One of the questions was how we have engaged community in this process, in particular BIPOC community. And I can speak a bit about the tribal consultation process. Certainly tribes were invited to participate in all of our work groups, and they did initially. And then over time, due to a number of different circumstances, the Indian Child Welfare Council, who is really the group that advises the commissioner on all things Indian child welfare, they really said we would like to have our own planning process, and we would like to, you know, that's going to take some time. It's not going to happen by the time we submit our plan, but we want you all at DHS, once we've developed that prevention services plan with methods that work for our communities, we'd like that to be added at a later time. So we're in the process right now of developing a proposal. And there's some funding from the Families First Transition Act funds that is dedicated to support that. If you all are interested in kind of more about American Indian communities and the clearinghouse and sort of the lack of, I guess, culturally specific services and that kind of a thing, the National Indian Child Welfare Council actually released a statement about that a couple months back. And, you know, it just really talks about the lack of services that are effective for our communities, and that, you know, we all should be looking to find alternative ways to lift up programs that will meet those needs in the future. So the other thing I want to point out is, and then Rebecca, you know, fill in the gaps, please, in terms of our work groups and the representation on those work groups. The other thing we convened about 2 weeks ago is a discussion with African American providers and American Indian providers around parent mentor programs. That's a service that we'd like to support in the future. And so we had a robust conversation about what works and what doesn't work with parent mentor programs in the state of Minnesota. And as I said, had African-American, American Indian providers at that conversation overwhelmingly heard that services like this, services that support parents by people that have been through the system and have had those lived experiences themselves, can really change the trajectory for families. So a little bit in terms of future thinking for added services.
Yeah, thanks so much for bringing that up while we wait for someone else to come forward with the question. I think that, you know, one of the painful parts of the conversation has been, you know, there's a lot of really nice values that are woven into Family First, and not always is the statute really meeting those values. And so I think that, you know, one of the criticisms about evidence-based practices in general is that they really do miss the mark across the board around where those practices are developed, how they're clinically evaluated, and then where we see effectiveness or not. And so, you know, as opposed to looking at practice-based evidence that really can drive, you know, the kind of system we want to build that's really, again, very family-centered and family-driven. So, you know, there's a lot of discussion about that, and then, you know, a reality check that, like, we're stuck with this federal law. And so we have to proceed despite the lack of meeting the shared goals and values that we have together. So I'm not necessarily making a question come out of my mouth at this point, but just appreciate that. I think that one of the things that we did talk quite a bit about now a couple of years ago in this process with the Family First Transition Act and some of those opportunities was just thinking about how it is that we might be able to create processes within the state to think about the development of future practices. And that, of course, is a really high bar because of all the clinical requirements, et cetera. But I think that continues to be something that we are, you know, curious about, interested in, glad to support. And that takes a long time, you know, the relationship development, the planning processes, the attachment to however we can design clinical responses. So anyway, just wanted to agree with you and appreciate what you just shared about, you know, all the continued efforts moving forward. And I really also appreciate what you shared. I'm going to Google the National Indian Tribe Welfare Council statement because I haven't seen that. But I think that is kind of what we have also heard a bit through these conversations is we're stuck with this federal law. And, you know, the association is in conversation with a lot of other state associations who lament the way that the law has been rolling out and the difficulties it's creating to serve kids and families in the ways that we want really across the board. But, you know, part of that discussion is, okay, so then how do we develop the kinds of responses, the service array that is meaningful to kids and families? So I'm also just curious about some of, we can't boil the ocean all at once, certainly, and have to submit a prevention service plan and everything is one foot in front of the other. But I know that one of the things that the commissioner was very excited about is Assistant Commissioner Brown's new deputy that's going to focus specifically on developing a prevention service array. I'm just curious if that position has been hired and any other news that you have about that work going on within your division.
So I'm not directly involved in that process. However, in the past, you know, that office with Lisa Bailey there certainly, in fact, early on, I think Lisa Bailey took a real leadership role in the Families First work. So what I know about that process right now is I believe they're in the process of hiring a new AC. I don't know a lot beyond that in terms of are they going to have a strong, you know, presence in the prevention area. It's something we can certainly keep in mind and circle back with you about. Jennifer Sommerfeld, do you happen to know anything further about that?
Yeah,
I to put you on the spot.
Oh, that's okay. What I know is this, is that I do understand that that position is going to have a focus on prevention services as one of, at least one of that person's responsibilities. And I know they're in the process of hiring somebody, but no announcement has been made yet. I would expect, hopefully we'll have somebody out there within the next 3 to 4 weeks.
Fantastic, thank you. And you know, we're just enthusiastic about those opportunities and glad to be supportive. But since I've made a couple of statements without really any compelling questions, does anyone else have a question? And welcome, Margaret, and I think Andrea to the conversation.
Lainey, I do have a question. This is specifically for the DHS folks. How do you see us as private agencies really being able to support, or what role can we play, if any, to support this process? Or how do you see that playing out for us? As I see a lot of the work is really internal through the governmental systems, right? So the rollouts of that, but how could we as private agencies support, or what role do you see that we have playing in this specifically?
That's a great question. You know, I would like to, you know, ask Rebecca if you know, thinking about the work group structure and that sort of a thing in terms of representation. I place high value on the work of the nonprofits across our state, the organizations that we contract with for the work. I think you're right. I think that, you know, in this process, certainly much of the focus has been on, you know, county relationships, tribal relationships, because those entities, of course, are the ones that are going to carry out the work. But certainly, you all are working with the children and the families that will be impacted greatly by all of this, by QI, QRTP, prevention services, and so I think, you know, we need to figure out a way, and if that means helping, you know, sharing our draft plan with you, you know, in ensuring that, you know, the invite is going out, you know, to those types of organizations to help inform our work. I think that's very much needed. So I don't know if you have more to add, Rebecca.
Yeah, I would agree with what Yvonne just said, and add to about thinking about how your services and what you offer programmatically, you know, improves the health and well-being of families, helps reduce maltreatment or prevent maltreatment in the first place, reduce initial entry for families or re-entry of families into foster or children into foster care. You know, addresses the disproportionality disparity that we see in our child welfare system through the offering of culturally responsive services that are coordinated across services. So those are some of the things that, and something that's sustainable, right, and accessible to families no matter sort of where they're at in the state. So those are some of the things that come to mind when I think about how we can move to improve and strengthen our service provision, and continue to talk with families, right? What are families telling us that they need or would have needed to prevent whatever their situation was? And so making sure that their voice is heard and that we're being responsive and as well as we can.
Mm-hmm.
Thank you, I appreciate it. I just know when I'm looking at, for instance, the plan is with the interventions, the evidence-based interventions, and how that might play out in the county systems. And I supervise a few contracted staff who are embedded within county systems. And so I've been hearing from that perspective in particular about just what it's like to be involved in the county system that's learning a lot more and perhaps quicker and having more discussions about this than maybe even we are as privates, and how to bridge that was just coming to mind for me. And the other part is really how can we be supportive, right? So that's a question that I think why we're here today and investing our time is how can we, at the same time as the plan, I get it, needs to roll out without a lot, we're not there. That makes sense to me, but maybe that question to continue forward is how can we be supportive? And are there any tasks or duties about that maybe are out of the public sector and within the privates? This is just a question that came to my mind in the process. So as the qualified individual has rolled out, our agency's been contacted about whether or not we would have staff that could be that assessor, for instance. So it wasn't really a surprise to us, but it really wasn't necessarily, and a part of the plan necessarily. It's kind of like, I think that counties by the statute could even pick a community member, for instance. So we weren't really sure what that looked like, if it was a community licensed individual or someone. Anyway, I just feel like how can we help in this leg of the process as well? And maybe the answer isn't now, but that it's the idea carried forward. So that's just what role could we play, should we play, if any, in continuing this process and or different legs that might grow out of the plan as it continues to grow. So thank you for the question, for letting me ask the question and your response.
Yeah, I'll just echo what Lainey said. Throughout this multi-year process, we have come forward regularly, and I guess this is another time we just want to be resources and part of the conversation, and knowing that everyone has distinct roles, and our roles of serving the community helps us to be able to see and do slightly different things than our partners at the state and the county level. So I'm glad to collaborate. And one of the questions that we were talking with counties at the beginning of this process as well, just about thinking about the opportunity to build statewide capacity with some of the prevention service array, and the concern being that we have parts of our state that really don't have a lot of capacity, and how it is that we might be able to make practices truly available to all kids and families, and thinking about the needed capacity development from a workforce and simply available services. So curious if the plan or a parallel process of the plan is seeking to do some of that service capacity development for both motivational interviewing and parents as teachers, as you think about that rollout in the summer.
I can hop in here. Yeah, I definitely think that's part of our thinking in terms of rolling these services out. Certainly motivational interviewing is something that any agency really could undertake, and however, right, there's going to be some limits on how many we can train at any given time, right, and then support mechanisms therefore. But so we will have to do some more planning about how we'd roll that out, who will maybe have access first to training, or if it's a first come first served. None of those have really been decided at this point in time, but our goal is to certainly expand them as much as they can be expanded, right? I think there's some communities might find that parents as teachers is actually not like a good fit for their community, right, or the families that they serve, and so may choose not to pursue different services, as an example. So we also heard with the parent mentor conversation, right, that parent mentors might not be needed across the entire state. There's already been some lessons learned there with some expansion with the current program. So I think we'll have to learn. Like Yvonne said, right, we're learning as we go to some extent. Historically, child safety and permanency hasn't really been in the business of developing services. Right, it's that's behavioral health does a lot of that work and things. So, and right, there's lots of coordination with not just behavioral health that we're doing, but also with our partners at the Department of Health as well. And so, like, how do we coordinate together at the state level to also help collaborate at the local level based on what the needs are for families. So
Well, thanks. And, we're glad to be, as we think about capacity development on all sides, we're certainly glad to be supportive, from a training standpoint, from potentially like an actual service development standpoint, from a discussion around placement standpoint. There's a whole host of kind of steps as we think about implementation. And I think that certainly counties are required in that conversation, and you all are required. And to the extent that we can also be assets, I think that that's something that we're very, very glad to do. Have been down the road of practice development a few times. So there's some helpful experience from that standpoint as well. What other questions or comments do folks have?
This is Rob. I'm just wondering what the historical kind of picture looked like on discussing trauma-focused CBT and how that, isn't kind of immediately integrated into the initial plan when we have providers across the state trained in that model, and it's is one of the first added to the clearinghouse. Why we've kind of moved away from that initially.
That's a great question. It is still on our initial recommendation list. We didn't initially have that at the top of our list because it's a promising practice. And so an evaluation component would need to be a part of an implementation of that. And what we also learned in some of our initial explorations of those 7 services is that trauma-focused cognitive behavioral therapy is widely covered by medical assistance or Medicaid, right? So the Medicaid or MA is going to be the first payer and would be the payer of first resort, I guess is the way I'll put it, over Family First 4E services. And so in terms of the opportunity for 4E reimbursement is not as great as some of the other non-MA funded programs. So coupled with the expense of the evaluation component.
Thanks. And I think just you are so steeped in this. I think that part of the challenge are the QI measures and the fidelity standards that need to be adhered to, and what states and counties need to do when thinking about implementing some of the promising practices, which would also apply to something like the Ohio Kinship Navigator as well. So puts a whole bunch of additional hurdles up when we think about the different levels of practices. So Rebecca, if you could just provide like a high level overview of what's required to meet those standards, just so we have like that working knowledge and that language floating here, that would be, I think, just a helpful reminder.
Sure. So the state has to have in place a plan to monitor fidelity. So how is the state ensuring that each, let's say, TFCBT provider is following the program as approved by the Federal Clearinghouse? So that's the first piece of it. And being able to report on that at a state level. The second component is a rigorous, well-designed evaluation study. And that's about as far as the definition goes that has been released by our Children's Bureau. But we would have to implement an evaluation component and have that as an ongoing piece as long as the rating remained promising. So that's the other component. So there's basically 2 components, the CQI component and then the evaluation component that we'd also have to implement.
Any other questions or comments? The one other thing I know that go ahead, Lainey.
I just thought I'd throw it out there as a question. The established evidence-based practices as listed in the PowerPoint and as you just described, Rebecca, do you know if there's going to be a way, or is it even by statute allowable that there might be one that can be added later? Maybe I missed that in the conversations. I just think of that. I know a couple of us as providers work alongside the ITFC program, intensive treatment and foster care program, where by statute there's evidence-based practices built in, and we've been able to help between us as providers and DHS navigate some other programs that are evidence-based coming in, which I think is where Rob was asking his question, I wonder. But do you think that there's some room for opportunity that others could be added later? Or I'm seeing some head shake a little bit, so I'll wait for your response.
Yeah, for sure. Great question. So this is not my understanding, is that they're reviewing services on an ongoing basis and receiving recommendations. So the clearinghouse is receiving recommendations of what to review. It's also my understanding that states can submit their own studies. So if we were to do our own evaluation, of course, we wouldn't be able to claim until it's approved by the clearinghouse, but we could do our own evaluation of a service and submit that for approval to the clearinghouse. So I believe like Ohio's Kinship Navigator program, right? That's their homegrown program, is my understanding, that they submitted to the clearinghouse. They initially did not get approval for that particular service, but we just saw that get approval for a promising practice. So there has to be certain elements that the clearinghouse is looking for. And I could send you the manual if you're interested in digging deeper into what they're looking for. But there's a certain number of studies and a certain number of factors that they're looking for in terms of outcomes for kids. Mm-hmm. So we do expect the clearinghouse as to continue to grow and expand, and what services are eligible for claiming. That, again, we'll keep a close eye on in terms of whether those services are available in Minnesota, whether they could be expanded, what we're hearing from community, from our county and service providers as well, tribal partners. So it's going to be an ongoing process. And I think, again, we're just trying to build the frame of the house at this point in time. And I think over time, what you'll see is us continue to build the floor and the foundation, all the things that we need to make sure that we can grow the program into something that it needs. And, you know, I think, Kristen, you alluded to this a little bit earlier too, but there might be services that that are going to be good for families that might fall outside of the actual Family First regulations, right? And so how do we look at those services that are going to be meaningful for families and find other mechanisms to ensure that those services can be accessible to families, or developed and accessible, right? And so I think that's our eye to the future in terms of services that are available, that it doesn't always have to fall into the regulatory guidelines, or can we make other things happen that we know will work or suspect will work for, and do the evaluation or studies, or just hear from our communities that they're working, right? So I think there's lots of options.
What, for folks, DHS folks on the call, what would the best thing for private contract providers working with counties already, what would be the best thing for those nonprofit agencies to do when asked by the county? What do you know about Families First prevention? When can we contract with you to utilize some of those funding streams to support individuals in our county? What would our response be right now?
Any advice on that, Rebecca?
I was hoping you had some advice, Yvonne. You know, I think it'd just be good to open the dialogue, open the door, and to that conversation with the counties that you're working with currently. I think, I'm not sure there's a one size fits all in terms of a conversation, because you know, different counties have different collaboratives and different services available and things. So I think you know, opening the door to those conversations and what you're seeing, and being open and transparent would be the first step in terms of what you're seeing as a need for the kids and families you're serving. Mm-hmm. And have it, you know, open the door for collaboration.
Well, thank you so much. I think that the one question that we will continue to be hopefully in some conversation about is just thinking about kind of a two-path process. One is amending and updating that prevention service plan to bring additional practices in that you know, we collectively assess will be of value to the particular candidates group that we're thinking about, you know, in our mind's eye. That is, you know, family centered and accessible to make available across the state. And then in that other parallel process, how do we build a service array that isn't encumbered by all of the family first requirements, that creates candidacy, that has a 12-month review? You know, I think that those are the other questions in our minds. And, you know, based on our history as a state of having a pretty little state general fund revenue going to support those prevention service practices, it seems like a fantastic opportunity to really build that service array as we move forward. So I'm very enthusiastic and supportive of both of those conversations, and understand that these things do take quite a bit of time, and really appreciate all of your effort and leadership to, you know, dot the I's and cross the T's to make sure that that plan is ready to go this winter. You know, to the extent possible, if it would be of value to you to hear some of the reflections from leaders within community-based providers, we would be certainly glad to review the draft and provide some feedback to you. But of course, that would have to be, you know, compatible with your process. So we would, you know, we'd remain ready and willing to help it any way we can. And really just are grateful for today's conversation and the opportunity to meet you officially, Yvonne, and see you again, Rebecca and Jennifer. So I guess the best way to conclude is thank you so very much, and we look forward to our next visit.
Thanks. It was really great to be here and to formally meet you, Kirsten, and others. Thank you.
Thank you for your time.
Have a great Wednesday, everybody. Take good care.
You too.
Thanks. Bye.